Welcome and good morning, everyone, to the COVID findings and perspectives from South LA and Southeast LA. We appreciate the time that you made to join us today. We appreciate the many community members who are here with us. My name is Rose Venegas, Veniegas, and I'm pleased to be able to introduce the convening to you today. In your screen view, if you're joining us on the Zoom view, you'll see that we have a sign language interpretation that's occurring, and Destiny, our beautiful sign interpreter, is spotlighted in your panels. We'll also be recording this session so that people who have registered or are not able to join us today will be able to view this in a later time when it's more convenient for them. First, I'd like to offer gratitude to all of the community members, the residents, and the people in South LA and Southeast LA who came together at a time and during a crisis that none of us were prepared for. What you'll hear about today during our presentations and as part of a conversation with a group of expert community members and panelists are what happened during the past 2.5 years when many of us were still striving to understand what was happening in the world and in our communities. And we hope by learning and listening together today, we can anticipate the best responses needed as our communities may face other challenges in the future, whether economic, physical, environmental, or social. And so I'd like to preview the agenda for you. And in the next slide, you'll see an overview of what will be occurring during the next 90 minutes or so. We'll have an overview of the results and findings of efforts from our South LA and Southeast LA networks. And we'll have 3 presenters, Dr. Delara Uskup, Ms. Cheryl Branch, and Dr. Wilma Franco, who will share policy recommendations from the work that they carried out for the past 2.5 years and moving into the next community crises. Next, we'll hear from a panel about the COVID-19 responses and experiences in these 2 communities from experts who lived through the community crises and who continue to advise our communities about how to respond as the next crises emerge. And we're graced with closing remarks speaker, the director for the Center of Health Equity in the Los Angeles County Department of Public Health, Ms. Sonia Vasquez. So there's a lot that we want to share with you today. Again, thank you very much. I want to introduce the planning committee organizations that joined us in putting together our event today. So we have representatives from research institutions, as well as community-based networks, and the partnership with the Community Foundation. So thank you very much to our convening planning committee. We appreciate you and are grateful for your presence here today. And now I'd like to ask for you to take a look at the reports that were published by our presenters who are coming up in just a few minutes. There are 3 reports that were sent out to all of the registrants, and they feature the findings that will be shared today with the group on the Zoom call. There's a report on equity and access to the vaccines that was prepared by the UCLA team. There's a report by the Crisis Response System of South LA. They have a 2020 impact report that's currently viewable on their website and a 2021 report that will soon be viewable. And there's a report on the crisis of COVID-19 in Southeast LA that was prepared by the CELA Collaborative. And so all of those reports were made available to registrants as you signed up for the convening today. We'll also include them in the follow-up email. And if I could ask the slides, terrific. We're here today to spotlight the community networks and leaders that led response efforts during the COVID-19 crisis in the communities of South Los Angeles and Southeast Los Angeles. Together, we want to be proactive in addressing the community's needs. We knew what these were going into the pandemic. These needs persist as we strive for recovery and resilience in our communities, and they will continue unless we take progressive and needed actions. And we want to urge all of us who are here today joining in this convening to start our planning efforts with these communities and the leaders in South LA and Southeast LA as we anticipate the availability of resources for response, recovery, and resilience. So I'd like to move next to welcome our three speakers for this first portion. And the three speakers will be Dr. Delara Uskup first, followed by Ms. Cheryl Branch, and then Dr. Wilma Franco. So Dr. Uskup, we'd like to ask you to join us on microphone. Thank you.
Thank you, Rose. The goal of our project was to advise and provide insights on how to reach communities of color and those hardly reached, to educate, build trust, and disseminate vaccines in South Los Angeles, given historical experiences with medical mistrust. Next slide, please. Our efforts centered around three goals, which were to facilitate community, public, private, and governmental partnerships to reduce COVID-19 vaccine inequity, educate communities of color in South Los Angeles about the COVID-19 vaccines through virtual town halls and summits, and finally, navigate communities of color in South Los Angeles on how to access available COVID-19 vaccines. We wanted to shift the prevailing approach to public health and turn the nature of the top-down process on its head. And I know I'm preaching to the choir here, but we know equity is a matter of justice. And equity in health access is critical as it leads to better patient outcomes, encourages workforce development, and strengthens our economy, ensuring we are supporting families. The community is our greatest strength, and that's what we're here to do today, to highlight what our community has been doing all along through COVID, before and after COVID. Next slide, please. We are just going to highlight three recommendations from our report, which is publicly available, and we will also drop the link into the chat. And the first is creating, investing in, and mobilizing a community-based health workforce. It is critical to create, train, mobilize, and support a representative community-based workforce to drive community outreach for COVID-19 vaccination. And what does this look like? This looks like strengthening partnerships and coordination, improving equitable COVID-19 vaccine outreach through partner coordination, documentation of best practices, and use of data for decision making. Again, changing the ineffective top-down approach we tend to experience, building community capacity, supporting continued investment in the creation of public health and wellness hubs in South Los Angeles, trust building and trustworthiness are processes that build on the principles of ethical community engagement, and efforts to invest in and build the capacity of community agencies, social organizations, and faith-based and faith-placed organizations are key to providing a sound and timely and continued response to COVID-19. Next, we want to reduce barriers to access. And to do that, we want to employ innovative strategies, vaccination on demand, healthcare on demand strategies, meeting the community where the community is and not expecting the community to meet us, and also deploying a community health workforce to address the logistical and structural barriers to COVID-19 vaccination. Third, we want to encourage dialogue and disseminate accessible information, develop and disseminate accessible information around COVID-19 vaccination through the community health workforce and other trusted channels to address informational barriers to vaccine access and acceptance. And this looks like having tailored and culturally appropriate messaging. Public health messages must validate historical and intergenerational experiences of mistrust and address patient concerns directly. And we must shift from a strategy of shaming and blaming to educating. Paternalistic, fear-based, and overzealous rhetoric are poor strategies to inspire behavior change. Messaging should be culturally informed, but also respectful. Next slide, please. We at this time want to acknowledge our community partners and other agencies, also our study team and our funders, the California Community Foundation. We want to highlight CRISLA, the Southside Coalition of Community Health Centers such as Kedron and St. John's, And also send a special shout out to Dr. Jerry Abraham, our very own super doc. We want to also thank all those who participated in our focus groups. And I am delighted to turn it over to Ms. Cheryl Branch, a superwoman and managing partner and co-founder of Chrysla. Thank you.
Thank you so much, Dr. Usku. I'm so excited to be here to share with you the goal of our network was to create a safe space in South Los Angeles for BIPOC populations and Black-led community organizations with the purpose to promote an equitable involvement for all. We who have a stake in the success and saving lives in our community were threatened with this very unplanned pandemic. And so it was up to us. We found out on March 14th to come together on our own. The county had no idea when they would have the time or the resources to assist us. So the question became for us, are we ready? Are we on our own? How are we going to get this done? And the community came together. This slide shows we're in the square. You see where it says expand the gap. I don't want to get too technical, but the network of small organizations with budgets typically less than $1 million a year, but they were boots on the ground. They could be innovative. We could communicate faster. We were able to form different levels of partnership and collaboration. We were able to add support systems that are probably considered off the grid. And there was an unmatched commitment to be that response, recovery, early warning, preparedness, and mitigation for our community of South LA. This is how we did it. The time and the demands of the community was becoming overwhelming to our system partners. And this is where our compassion, our faith, our love came together to help them to respond. And that we learned is called the excess capacity in the community was able to help us meet the needs. Next slide, please. And so the community response system of South Los Angeles was born. This would not have happened without the heroes who were like-minded that already worked in the institutions and local offices of government who have to be mentioned because they helped us because of who we were, a network of grassroots organizations that came together. And these are the like-minded people in the system. USC, outstanding work as an institution. UCLA, Dr. Delara and her team, they gave freely hours to help us make sure that we had a systematic, safe approach to putting people on the streets at a time where we were all mandated to be at home and meet the needs of our community. Over 20,000 care calls were made with the help of USC undergraduate and graduate students and our community health worker volunteers. So this is really like where we show the value of a community level intervention. If you look at this, there's over $20 million of leveraging that happened in 14 to 21 days and consistently continues to meet today. All we had to be was included in the conversation. Next slide. All right, at this time, I just want to thank you and turn it over to Southeast LA, our nemesis, our partners in this effort, Dr. Franco.
Thank you so much. Appreciate it. And first, let me just say thank you for creating the space, and just a huge thank you to not only our South LA colleagues and their leadership in this, but also to CCF for carving out this space for us as we continue to really uplift some of this work, right? So as we shared, my name is Dr. Wilma Franco. I have the honor of leading the SELA Collaborative, who's really, our organization is a network working in the Southeast region. And our focus are in 3 areas: civic engagement, nonprofit capacity building, and data-driven research, all grounded on a regional strategy. So what you see here is really, that geographic area that we do our work in, and how we as the collaborative define the Southeast LA region. Next slide, please. So one of the things that we often talk about, right, is our mission and our vision as a network, but collectively we do have what we've identified as our North Star, something that we're working towards, and really thinking about how do we improve the quality of life for Stella residents by working on creating and harnessing the power of a cross-sector collective voice that advocates for the region at the county, state, and national level to really bring resources and create opportunities that improves the quality of life throughout the Southeast. So unlike other organizations, right, we are not a service provider. So it's important for us to highlight that because our work is really done through the network that we have created, and you'll kind of learn a little bit more about today. Next slide, please. So in 2019, one of the things that we began working on was really this notion of creating a leadership network. At the time, right, we really brought together a number of organizations that were really doing work in the Southeast. I think historically, when folks talk about the Southeast region, it's always been seen as a desert of nonprofits, right? And what we learned was that there was already a lot of leaders working in the Southeast, doing a lot of work for community. They were just not necessarily very well known, right? So one of the things that we did was put together this Stella Leaders Network. At the time in 2019, we had about 40 to 50 leaders. As of March of 2022, our network has really kind of expanded, and we began using this network mapping tool that really began to highlight not only the relationships and the interconnectedness of all these leaders, right, but also thinking about where there's alignment and potential collaboration around policy areas. So as of today, our network includes more than 260 leaders representing close to 100 organizations, agencies, and community members, some of which I know are here today, so thank you for joining us. And what really we learned through this process was the fact that creating this space for Stella, about Stella, with leaders really was something that we could utilize and really begin to nurture these ideas of coordination and collaboration to work together for the, keeping in mind the best interest of our community, right? So next slide, sorry. So why is this important, right? For us, this network really allowed us to create and collectively come together to create what we call the Stella Agenda. And I know our team will drop the link in the chat for those of you that have not read that report. But this was one of the most amazing and collaborative coordinated effort that we have led with over 80 leaders through a 3-month process, right, that really began to look at what are those policy areas, and as we think about recovery and long-term sustainability and investment in Stella, right, what we knew at the time was that there was not equity when it came to testing, right, for COVID, that there was a number of needs that our community in the Southeast were not being met, right? And then so this really allowed us to bring together not just the network, their expertise, but also begin to look at, as we think of recovery, how do we ensure that Stella is not left behind and out of these conversations, right? So next slide. One of the most urgent needs that we collectively identified was around healthcare, right? And our partners at Altamed really supported these efforts, right? And identifying, through the work that we were doing, we knew that one, we were left out of the testing piece, right? And really thinking about how do we make that an equitable distribution, right? But also thinking about, as we continue, right, and at the time we were still in the conversations around COVID vaccine, and we knew that this needed to be a priority because our biggest concern was that we would be left out of access to the COVID vaccine for a region that was identified as the epicenter of COVID in LA County. So in 2021 on March 1st, we launched our Stella Agenda, but on March 5th, we became the lead CBO on Stella for COVID vaccine, right, in partnership with FEMA with CalEOS and CalState and really utilizing this strategy of collaboration and coordination with a number of partners, right? Not just our elected officials and cities, but really everyone that we had begun to really convene for the last 2.5 years or so. If you go to the next slide. So one of the things that we learned through this work was that we really, as a network, right, could play this coordinating role, right? We, at the time, were given about 5 hours to put together this strategy and this process by which we would disseminate vaccines, right? At a time when we were hearing, right, and the narrative was not a lot of community wants to get vaccinated. There's not enough vaccines. We knew that coming together and really leveraging different partners, right, would be the way for us to really mobilize our community. When we began this work, right, I do want to acknowledge a lot of our elected officials who were the first ones that we really partner with, Supervisor Solis's staff, who were in the trenches with us, Senator Lilian Gonzalez, Speaker Rendon, and a number of the other elected officials that were really key and instrumental in ensuring that we were successful through this process. We knew at the time as well that a lot of our CBO and partners were already responding to the many needs and trying to meet basic needs for our community. So they were not necessarily the first that we tapped into, but we knew that this would be a hands-on deck strategy because we needed to make sure that we were able to reach our community. So at that time, I do recall very specifically that we were told, on average that we were doing 150 to 200 vaccines. We broke records. We booked more than 450 appointments in less than 12 hours. And I do specifically remember that day they told us, we hit 750 appointments in one day. So this narrative that our community didn't want the vaccine wasn't what we were experiencing on the ground, and really led to the governor visiting our vaccine site, right, to really look at what was different. And what was different was this collective, collaborative approach of working with all the different partners and sectors to reach our community. Next slide. So as we think about just moving forward, right, and what really informed our SELA agenda were these recommendations. One is the need to invest in the Southeast, right, in our communities that have historically been left out of these conversations and have not been given the resources to respond to these type of crises, but are also oftentimes the one that are heavily impacted, right? The other piece for us was really leaning in and following SELA leadership. I think both South LA and SELA have a network of leaders who do amazing work on the ground, but oftentimes they're not at the table, right? So how do we ensure that we give voice to their expertise and really collectively challenge ourselves to move beyond this idea of expertise based on the degree that I hold, but more so on the lived experience of our communities? Because, going through this work, right, one of the things that we learned was that when those communities are not at the table, right, oftentimes these processes are not set up in a way that helps our communities that need it the most, right? The other piece was, how do we address all these challenges? And COVID really highlighted the intersectional lens of a lot of these issues, right? We can't talk about health without talking about the environmental injustices to our community and how systemically this has been allowed, right? Additionally was this need for, how do we strengthen the nonprofit sector? As you all know, right, we have heavily relied on our nonprofit sector. We really are, and the nonprofits represent the safety net to our community. So as trusted partners, right, how do we create these opportunities where we can continue to strengthen them so that they can continue to do the work that we have all seen, right, and allowed these collective wins for our community. I think the other piece that has come forth for us is continuing to deepen civic engagement, right? But not just outreach, right? But moving beyond just outreach into our community, but it truly engaging them in the conversation so that they can be at the table. And I do specifically recall some of our leaders saying, there's also a need for us to compensate our community, right? In terms of their expertise and honoring what their contributions are to a lot of these processes for us. And I think the last piece for us has continued to be the accountability piece. How do we hold ourselves accountable, but also how do we hold government and systems accountable to ensuring that we look at addressing these crises and just really thinking about recovery from an equity perspective, right? So next slide. So I'll end with this from a quote from one of our colleagues and future doctoral, Dr. Maria Loya, right, who, when we think about these challenges, right, and I think one of the piece that we have consistently heard is the resiliency of our communities, right? But oftentimes, and as you know, Maria mentions, oftentimes the burden of overcoming challenges and stressful situations of individuals are often addressed from this space of oppressive, not acknowledging how the systems are actually creating these barriers, right? And how it impacts the quality of life of our community. So really to think about creating sustainable and meaningful change is going to come from creating systems change, right? How do we look at the systems? How do we challenge the systems to create resilient systems, right? So that we can support our communities as we move forward. So I think for us, this space is very grateful that we have this space to be able to talk about some of the wins, but also how do we move forward, right? And how do we begin as we think about recovery, because we're not done with COVID and this pandemic, but how do we begin to really challenge the way that the systems have been created that have allowed the experiences that our communities continue to experience. And with that, I'll thank you for the time, and I'll hand it off to Rose.
Thank you very much, Dr. Franco, Ms. Branch, and Dr. Uskup. I think your comments and reflections and the 3 reports that have been shared in the chat window with our participants, they really reflect how the systems were not able to respond as quickly as we needed. And so each of your networks and your partnerships really filled that gap. And Ms. Branch, I remember your slide talking about how there's a gap between the community's needs and systems ability to respond. How do we expand capacity to fill that gap? And how do we support change in the systems that's resilient to the next crisis or the ongoing recovery needs of our community? So really, really grateful for you all. And we often don't take the time to reflect. Once a crisis is done, we move on to the next crisis. So I want to ask all of you who have the ability to show a reaction right now on your Zoom, use your reaction button and share some love, share some applause, share something that you think reflects just your ability to support these kinds of networks. So I really appreciate everyone taking the time to join us today. You have joined us for the COVID-19 findings reports from the South LA and Southeast LA networks. And I have the honor and gratitude to introduce our panel moderator today, who will introduce our esteemed panelists. Ms. Carrie Broaddus is an activist and advocate and currently is working with the LA Metropolitan Churches. But I've known Carrie, Carrie, probably over about 20 years now. And so it's wonderful to be with you today. And thank you very much for opening up the conversation with our panelists. So Carrie Broaddus, I hope you'll join us on microphone and audio.
Thank you, Rose. I'm going to get right to it because I want to make sure that we have an opportunity to have the panelists share their thoughts. Let me start introducing our panel. I have Dr. Cynthia Gonzalez. She's the Director of Community Partner Policy and Action, a Professor of Policy Analysis at Pardee Ron Graduate School. I also have Dr. Ian Shapiro, a Faculty Lead for Health Education and Civic Engagement, Ultimate Health Services. Ms. Vargas, Associate Vice President of Operation and Chief Mission Officer, California State University, Los Angeles. And Dr. Santana, she is the Associate Provost of Academic Service and Campus Nursing Officer of Charles Drew University of Medicine and Science. We have our very own Ms. Naomi McSwain, Executive Director of Al Wooten Jr. Youth Center, co-founder Crystal Education Committee Chair as well. And we have Mr. Robert Salcido, President, CEO, Community Build Incorporated, and also co-founder of CRISLA. And of course, our Dr. Weewu, Outcome Project Director, CRISLA. And with that, I'm going to go right to the questions. One of the things I wanted to share first is that as I was talking with Rose, I said, Rose, how were you able to do this? How was this pulled off from South LA to Southeast LA? And she said, we lead with the best intentions and we offering grace to one another. Starting off, engagement. So when the first question I want to ask, it goes to Dr. Santana. Excuse me, it goes to, I believe, Ms. Vargas. Why did these collaboratives come together during the COVID-19 pandemic?
Thank you, Carrie, and thank you all for inviting me to be part of this really important conversation because I think it's so critical to learn both what has worked and what worked, and also to learn what we need to continue to do to support our needs in the community. So just I'll quickly just share my role here at Cal State LA. My role is Chief Mission Officer. The mission reflects the campus's mission of engagement, service, and the public good. And that is a mission that comes from the top. I sit in the president's office. And so Cal State LA was very privileged, frankly, to be chosen by the White House, by President Biden, to be the first mega vaccination site in Southern California. It was a huge task. We had 12 days to work in partnership with our government and community partners to get the mega site up and running. So part of the reason why Cal State LA was chosen was its location. And as so many have already shared, our greater Los Angeles region was definitely one, if not the epicenter of this horrific crisis that we were facing. And so it was really important that since the mega site was going to be here at Cal State LA on the east side of our Los Angeles community, that we do everything we could to ensure that our surrounding community get vaccinated. This was ultimately about saving lives. So the goal was actually to vaccinate up to 8,000 individuals a day. And that included what many people experienced and saw on the news, which was this mega drive-through vaccination. We had a walk-up to address issues around ability, but really the focus that I know we and others as part of this partnership with our government partners were focused on was what was said earlier, which was how do we get to the community, those individuals that really required us to go to them and frankly, work and educate and convince them to get vaccinated. And that was the mobile vaccination.
Right. And so kind of in other words, meeting people where they are.
Absolutely.
And so in terms of why did these collaboratives come together during the COVID-19 pandemic, I want to switch to Ms. McSwain from CRISLA. Give me your thoughts about, as Ms. Branch spoke earlier, boots on the ground. What was your experience?
All right. So I am co-chair of CRISLA's Education Committee, and the committee started in June 2020. So that was like 3 months after CRISLA itself was founded. So as far as CRISLA's founding, I'd like to defer that part to Robert. And I don't know if Robert, if that's okay, Miss Carrie, if Robert can share that much.
What I want to say is, Ms. McSwain, your involvement Why did you
Okay.
come to collaborate?
All right.
It's about
Okay.
you.
Basically, over 700 kids, parents enrolling over 700 kids coming to us for virtual private tutoring. We were not
Oh,
prepared for that number. We were only able to serve something like 250 of those students. But when I got that number, which we and the time frame in that we received it, which was over like just a month's time of enrolling over 700 kids, and I knew, you know, it was abundantly clear that the Wooten Center could not serve all of those students, which broke my heart, right?
mm,
So, you know, all of our hearts were broke seeing the schools close and the kids at home, and you know, and I had grandkids that were with me the first 3 weeks of the pandemic, so I knew what was going on with the schools and the
uh-huh.
assignments and all that stuff. So I went looking for help. And Cheryl called, and well, Cheryl had mentioned to me about Chrysler, and so I came to the meeting that first day looking for help, looking for, you know, what are we going to do to help our kids with education, to make sure they get the schooling that they need? You know, are there any other agencies out there that are providing tutoring that I can refer these kids to? So I came looking for help for those 700 students. And when I asked Robert a question, I said, you know, does Crystal have, you know, any initiatives around education? And he said something to the effect of, well, would you like to start one?
Well, now see,
And
that's
so,
those who participate in the process greatly benefit from the outcome,
right.
right?
You know,
Okay.
I mean, and actually I told him, I said, don't tempt me, you know, because, you know, I mean, I'm here because I'm concerned about this. And so that started everything. And so we put out a call for, you know, we scheduled a meeting time, and over 30 folks showed up at that first education committee meeting. And
Wow.
uh, and we,
So you did a call to action, so to speak,
yes,
and
did a
the
call to
response was how
action.
much? How many?
Over 30 agencies came to the first meeting,
Hmm.
and continue to be involved and are still involved today. And we determined after, you know, much discussion that our first initiative would be case management, because the issue at that time was engagement, right? How do you get the kids to log in? You know, how do you get the parents to be supportive? And so we did some case management training. We did 4 workshops with Genesee Center with their expertise. All that material is actually still available for anyone on the CRISLA website, crisla.org/education. So we did case management. Now we are currently working on private tutoring. So we just did a high dosage tutoring workshop. It was wonderful. 16 agencies there learning how to develop high dosage tutoring. And so, you know, just being a part of a group where you can touch so many people, and again, trying to serve hundreds of kids, right? Was the
Well,
original
so
goal.
now let me interject something here, McSwain. That was your experience,
Yes,
right?
yes,
And what I heard from you is this local access, meeting people where they are, and being involved yourself,
that's
right?
right,
Recognizing that there was a need and fulfilling that need, not depending on someone else, but
right.
stepping up to
Oh,
the plate, as they
100%.
say,
You
right?
know, and
I,
like I always say, you can't depend on somebody else to save you. You got to learn how to save yourself.
Well, now,
And so,
Ashe. So I want to go to Dr. Gonzalez. I want to ask the same question. Why were you involved in this collaborative, coming together during this COVID-19 pandemic when we had a shutdown, lockdown, mask down?
Hi,
Dr.
everyone.
Gonzalez?
Yeah, I'm here. Can you all hear
Okay.
me? Yeah, great. Thanks for the question. Thanks for sharing this space with just such amazing, powerful folks. I'm humbled and honored to share this space with you all. Just a little preface, I am a daughter, first generation daughter of Mexican immigrants, born and raised in Watts. So I salute you all from Watts. I still live here in the neighborhood, and I had the privilege of achieving education in a way that led me to finish a PhD, and am now directing a PhD program at the Party Ran Graduate School. The PhD program focuses on doing a lot of what we're talking about here. It trains students on those methods that oftentimes we need to understand to shift systems. So policy change, economics, all, really heavy on the math actually, and really understanding human systems. And then usually what we do is put it in a report and we're done. it never gets back to our community. We don't have implementation strategies. We don't understand what we do after knowing what we know, right? And so now with this program, we're actually training students to take the work that they learned, the work that they did in collaboration and partnership with community to community. So all of their training and their required deliverables require them to actually translate, implement, transition their work from a simple report to an actual action, something that our different partners can use. We were privileged work with the CELA collaborative to have our students join the vaccine distribution. I will say that what we learned from COVID was actually meant to do what it did. Those of us that are working in social justice, health disparities research, and advocacy, we understand that the system was designed to do exactly what COVID shed light on, to create inequities, to show the stark health disparities and divide and social determinants of health. We can pull ourselves on our own, and we can actually do the work if we had the opportunities and resources that merit our well-being. And we understood that that's not the case. So right now we're sitting in a space where not only were we dealing with all of these inequities before COVID, but now with COVID, the gaps only got larger. Right. And so the reason I definitely joined Dr. Franco and the CELA Collaboratives team was that I saw that they were doing something drastically different. Questions like, how did you get 750 folks in a day was a very easy answer for them because they were listening to community. And it's just really surprising that systems and government and folks who sort of were on the front lines of this didn't understand that really you just ask our people and they know how to respond. So I can go off on all of this front with you all, but just really understanding that we knew that we were warriors in this fight and that we needed to respond. And there were leaders like the CELA Collaborative that really heard the community rather than repeating what was not working. And our students were able to learn from that.
So Dr. Gonzalez, what I'm hearing is that each one teaches one, no one gets left behind. But more importantly, what I also heard, and I want to shift this to Dr. Weevil, understanding that we have urban myths, and so in your effort to collaborate, what brought you to the COVID-19 crisis and collaborate with CRISLA?
So that's for me, Carrie?
Yes.
Okay, thank you. Absolutely. So first of all, I just want to say how much I appreciate CCF really highlighting things that often are happening in the community that don't get attention, because there's so many strengths that you can see here. And it's really been exciting for me to be part of it. I was already involved with some things in South LA and some collaborations with Los Angeles metropolitan churches. And as the COVID happened and I heard from Cheryl and Robert that they brought people together and they were really looking at, wow, this is really scary. There's a people in need, the community's suffering, and there's so much that needs to be done, and there's so many disparities. So I was aware of that and just really concerned about all the people out there who were at risk of hunger and homelessness and death. As Barack Obama has said, our destiny is not written for us, it's written by us. And I feel like that was the theme that the leadership team came together around. We're not going to wait for somebody else to come along and take care of us. We're going to come together and we're going to advocate. We're going to let people know, hey, we're here. Here's what we know. Here's our strengths. Here's our knowledge. And we want you to listen. And then we began listening to each other. And I felt like I brought something important to the team because of my connection with USC and students. And I was able to get a very large number of public health students, masters, and social work students to come in and help do some of the tasks that no one else had time to do because everyone was so overwhelmed. So I mean, they were making a lot of the care calls initially. They were helping to organize things. They were sending out newsletters. They were just really helping in a lot of all our social media. They did all our social media. So it was really exciting to be part of that. And I feel like the students told me they got so much from it because they were learning about the community, the realities on the ground. And that was exciting to them. They felt like they were making a contribution.
Right.
And then what happened, as our impact report for 2020 showed, that first year we gave out over 4 million pounds of food, close to 1 million items of PPE, and 185,000 tests for COVID. So I feel
Right.
like that's pretty outstanding.
And so I want to keep this moving. I want to go back to lead with the best of intentions. That's what I'm hearing from all of the panelists so far. And it takes me back to the lessons of the geese, meaning as each bird flaps its wing, it creates the uplift for the birds following. By flying in a V formation, the whole flock adds 71% of the flying range if each bird flew alone. Here's a lesson. People who share a common direction and sense of community can get where they are going more rapidly and more easily because they are traveling on the thrust of one another, engaging, boots on the ground, meeting people where they are, asking people what their needs are, as opposed to giving them what you have as opposed to what they need. So I'm going to go to our second question. And I'm going to pose this to Dr. Vargas, excuse me, Ms. Vargas. What are the strengths that were reflected in these collaboratives? What were some of the strengths? I know there are many, but.
So with our work specifically with the Cella Collaborative this was an existing network of nonprofit leaders, community-based organizations who have been serving and working and are actually part of the community for decades. So that was the strength, is that it wasn't one organization or one leader. And that's the power that we all know and what we're all talking about here today. And it really was the strength is that they deployed what we all know works, which is grassroots organizing and going into the community, right? Going into the community and meeting them where they're at. What do they need in order, and that requires trust. And the beauty of the collaborative is because of the history of their work, there was that trust that was already established. And with the collaborative, it was this network that also spanned this very large region. So you were able to access individuals, right? From different cities and communities, organizations that worked with people in the health, area, in the educational area, in the social services area, with our faith-based. So the strength was, the scope, the scale, the approach, which is around really respecting and understanding, and that cultural competency that is required, right? Especially we're talking about, having folks,
Okay.
This was we were asking people to get shots, right? And with all of the historic distrust that has existed, it was really our community that would be able, to educate and help them, understand this and do this work. So as you said, Carrie, I can go on and on around the strengths, but.
So let me moving on. Thank you, Ms. Vargas. I want to go to Dr. Santana again regarding what do you think are one or two strengths. Dr. Santana.
Hi, and good morning, everyone. And thank you, Chrysler, for having me here. I bring you greetings from Charles R. Drew University under the leadership of our president and CEO, Dr. David Carlisle. Again, my name is Dr. Delia Santana, and for those of us on the call who do not know, CDU is located, just a little bit about CDU, is located right here in South LA in an area called Watts Willowbrook. So we're right in the area of some of the highest need in Los Angeles County, and especially needed the need at the point when the pandemic started and still continues. So needed COVID-19 support. And you know, CDU is really the only HBCU west of Texas. We're the second most diverse private university in the nation. And so we felt the need to serve the people who look like us. And we partnered with others in the community because we felt accountable, a sense of humanism. And right here in South LA, so we had to partner. And I can point this out as one of our strengths because we live, work, and play in this community.
That's the key right there. Live, work, play, and oftentimes worship.
Yes,
right?
absolutely.
Other people call it socializing, right? So thank you, Dr. Santana. I'd like to move on to asking Dr. Shapiro, how do we sustain the infrastructure established by the COVID-19 in SELA?
Ms. Carey, thank you so much for your question. I have been serving the community from LA County to Orange County for the past 6 years. I serve in Altamed, that is a federal qualified health center, almost reaching out to 400,000 members. Then one of the saddest thing is that, you know, me as a physician, we can have all the doctors that we want, all the clinics that we want, but the real magic happens when we have CELA as a partner and other collaborative partners and community members that are going out there and sharing our stories, and most importantly, the part of communication. One of the things that we have learned, it has been that talking to each other, it's a basic need that we have. At the moment that we as a group, as a community, we are silenced, we already know that there will be a lot of misinformation and disinformation. Right now, we have an infrastructure that needs to be tested. And sadly, right now with monkeypox, with mpox, we saw how all the errors that we thought that we learned from COVID-19 continue to happen. Then answering the question regarding the infrastructure, we need to make sure that we are reaching out as a group and talking to each other. We already know what are the CDC recommendations, the HHS recommendations, and our job is to make sure that that information is being transferred to our promotoras, to our promotores, to our community healthcare workers on the ground, in churches, in community areas, in parks, in schools, to make sure that we're giving enough information, because it's not about education. Our communities already, they are doing amazing things. They have 2 or 3 jobs. They are running from one side to another, and they're amazingly essential, not just to the community, but to their families and to each other. Then at the moment that we understand how can we use the infrastructure that we have right now for community and communications, and we gather the information about testing and future problems that we will have regarding vaccines, and making sure that we also teach a lot about mental health, and we unite all these efforts that we have as a community, not as doctors, not as nurses, but all together, and create the magic on the streets. That's, I think, the infrastructure that we need for the future of not just, you know, COVID-19, but diabetes, obesity, mental health, depression, anxiety, and all the other things that we have as a community.
All the other sort of, I like that phrase, magic on the street, right? And so I want to go to Mr. Robert Salcedo and ask this question. In light of the achievements of these collaboratives, how do we fund these human-centered, community-responsive services delivered by culturally specific organizations?
Thank you, Carrie, for that question. And thank you, CCF, and all of those who have participated in this today. And let me take this opportunity to thank all of the folks involved with CRSSLA, CRISLA, who really made this work and believed in the direction we were going. You know, when we ask that question, how do we fund this? How do we keep it going? It comes down to a very simple thing, and that's to prioritize. One of the biggest concerns we have in California, and specifically Los Angeles, is we get disaster amnesia because there are huge swaths of time between a disaster. We have to recognize that both civically and philanthropically, that we must make an investment to ensure that we have a sustainable infrastructure across this region that impacts people in the most positive ways. CRSSLA, as well as CELA, both became the equivalent of the Red Cross of urban America. That has grown in many, many ways. And, you know, Harvard Business Review has done several articles about being fast, flat, and flexible. So I do want to highlight the fact that CRSSLA did the reverse. We took a we the people approach, going to CBOs, going to churches and individuals, and then inviting government in later so that this would not be someone's pet project, but would be something that would be sustainable for long-term funding at the state, federal, and local levels. And lastly, we wanted to make sure that a culture of care, which is what we're all talking about, is a culture of care and meeting the needs of people. So for example, one of the new things we're looking at is changing languages. So anything mental tends to run people away. What if we change that to psychological wellness and psychological fitness? How many more people could we help? So staying ahead of the curve and being forward thinking in all that we do, and making sure that we continue to leave a platform for people to come and do their best work.
And so I'm going to pose the same question. I'm going to swing it back around to Dr. Shapiro. I want to pose the same question to you. Can we keep it just kind of brief? Because I want to turn it over to Rose after your comment.
Ms. Carey, we have a choice, and right now we need to figure out what we want to do. Usually we can actually just wait to have a disaster, and Mr. Saucedo is actually sharing that part, or we can actually start creating resilient communities where we're flexible, we're nimble, and I love this phrase, we need to fail fast and learn fast also. Then we need to actually have that infrastructure today. We don't have time again for COVID 2025 to come back and have the same problems, or whatever pandemic is coming, or diabetes or obesity or whatever we have in front of us. If we're not taking care of our community today with preventive measures, we're talking right now about mental health, medical health, what's happening with social determinants of health, that magic that happens outside of our clinics and hospitals, we are going to have the same results with the same problems, and we're going to have the same conversations, because in 2009, you need to remember regarding H1N1, and with this will be my final saying, with H1N1, we had very similar things in a tinier perception of what we saw today with our communities of color and underserved communities, and the results are horrible. I do not want to see and talk to my kids again and tell them, well, we didn't have an infrastructure. We couldn't talk to each other. We knew that we had the medication, the testing, and everything else, but sadly, because we couldn't reach out, people died. Then this is the moment to invest, and this is the moment to actually reflect of the things that we have right now and put that money to work. Maybe it's not $10,000 billion, but we know that we're nimble and we know how to use it.
And so what it really comes down to, I hear a common thread throughout all of the conversations and the comments, and that I want to turn it over to Rose, because we have a lot of moving parts. We have the county and its effort in terms of addressing equity in health. We have the city working on participatory budgeting. We have federal dollars that have come into the coffers around rebuilding the infrastructure. So I want to turn it over to Rose to introduce our next panelist. Rose?
Thank you very much, Carrie, and thank you very much to our panelists for sharing their experiences and perspectives. I think the comment that one of our panelists made with regard to where can I go to get help in this moment, in this very moment, I need help now. I don't need help 2 weeks from now. I don't need help 2 months from now. And Ms. McSwain, I think you shared that when you asked the question was pointed back towards you and you answered the call. So I appreciate that sort of metaphor for when crisis hits. Often we are the first responders. So thank you very much for the insightful comments from all of our speakers. Each of your stories that you shared took me back to those moments when the public health emergency was declared, and many community members, including the folks from Chris LA, the Southeast LA Collaborative, our UCLA, USC, and other academic partner teams responded. So we are transitioning in this portion, but we would like to take a couple of comments. I know there are some folks who are eagerly hoping to make a public comment just after our panelists. And I want to call on Council Member Santana, if you're still with us. Thank you very much for your patience, Councilwoman Santana. Would love to take your comment if you can join us on audio or on video.
Absolutely. Good morning, everyone, or good afternoon. It is 12:02. Hello, my name is Maricela Santana. I am a councilwoman here in the city of Linwood. I'm sure all of you know where Linwood is. Everyone here on this panel knows where Linwood is. And, you know, first of all, I wanted to applaud the work. I wanted to applaud the work that Cela Collaborative did during COVID response. I think that is it was amazing, the work that they did here for our region, and so I want to applaud their work. As you all know, and I'm only going to speak about Linwood for a bit, but as you all know, the city of Linwood was turned into a national case study. And of course, you know, Southeast LA, Linwood, and all of the Cela cities, the only thing that divides us from South LA is the railroad tracks. But in Linwood, 1 out of 6 people contracted COVID, and then 1 out of 400 people in Linwood died of COVID. So I wanted to answer some of these questions that were going up earlier about why the collaboration worked. And it worked because for years we have seen how the inequities in the health industry and the health access have affected our communities. And but this wasn't something that was going to go away. This wasn't just a flu, a cold. This was something that was taking our people from our communities. This was something that was taking people's lives, that was taking our families. And so yes, we did do a lot of work with Cela Collaborative. They were the first to step up to bring us the COVID vaccine here to our region, along with Supervisor Hilda Solis and Assemblyman Rendon, because these were our people who were dying here in this region. We were like the epicenter of COVID. And so it was imperative for us to work together in this moment. We couldn't let this moment pass us by and all of these people from our communities die in vain. So yes, thank you very much for this space to discuss this important topic about our communities. I think it did have a lot to do with the engagement and the collaborative efforts that have been created between a lot of Cela leaders working together. You know, we actually started working together the year prior to COVID. We all got together to speak out against Exide and what was happening with Exide. So that work, that collaborative work came in so handy when COVID hit, because now it's like, what do we do as a region? What do we do as elected leaders here in the Sela region to make sure that our people, that our cities had access to this life-saving vaccine? That,
thank you.
I'm
Thank
sorry,
you, Councilwoman
thank you.
Santana.
Thank you so much. Thank you.
I appreciate your reflections, and I think your question is the question that I think remains with us in terms of listening and learning and planning together for the next response. And I know Dr. Franco appreciates the connection and partnership with your office and other elected offices. And Dr. Franco, I wonder if you could join us on microphone and offer a brief comment. And I believe we have one other community member who'd like to make a brief comment as well.
Yeah, no, I think it's just great to hear the conversation and everybody's perspective, right? And thank you so much for all the leadership that's displayed here. I think one of the things as I was hearing this, right, and one of the many conversations that I've had with leaders, right, is that one of the conversations we haven't carved space for yet is how has this work also impacted our own leaderships, right? Because a lot of this work, right, and as we kind of named this conversation, like we had to respond to what we knew we had to do at the time, right? For our communities, for our families, right? And then, but I think we haven't created the space where we can have a very vulnerable and open conversation about what was that impact to all of us as leaders who were on the ground, right? When we hear of some of our promotoras that were walking the streets that, we know specifically one of them who had a heart attack right after some of this work, right? So how do we create space to also honor their contribution and their expertise and talk about the mental health and the other aspects that also comes with taking on these roles, right? And supporting our communities, because we do it from the place of love and wanting to help our community, but there's also an impact to a lot of our leaders that are here and speaking and voicing these experiences that we've all had.
Thank you very much, Dr. Franco. Really appreciate your closing thoughts on that. And unfortunately, I think we have time for one more comment. And I know there are several folks in the queue who would like to make a comment. We do have one more closing speaker, and so would like to be able to transition to that. But if I could ask Mr. Akeem Watts, I believe that you were hoping to make a comment, Mr. Akeem Watts, and if you could join us briefly on microphone and keep your comments very brief. We hope to also hear from our final speaker for today. Thank you. And if Mr. Watts is no longer able to join us on microphone, please feel free to share your thoughts and comments in the chat, Mr. Watts, and we'll be able to include them. Oh, hello. Hi there, Akeem. Are you able to join us on microphone, and can you share a brief comment? We are going to be transitioning to our next speaker soon. Thank you.
I'm sorry, what did you ask? I'm in the office and I was
I think that Ms. Branch suggested that you had a comment that you wanted to make.
Oh, well, I do. I really, something that I noticed with working with Chrysla is that during the pandemic, collaboration seemed like the most important thing with community-based organizations and all during that time. And myself, during the pandemic, I was at home. I reached out to Cheryl Branch and Chrysla's network. They trained me as a community health worker and even connected me with Core Response, which I work with now. And I began providing testing locations in collaboration with or connecting with the Chrysla network, and found locations throughout South LA to provide COVID-19 testing throughout the pandemic. So it's Chrysla, LA Metro Churches, those organizations are full circle for me. And now I'm a program coordinator with Core Response here. and always chime in right there at with Chrysla. A lot of help and support from the whole team there, and something that was consistent when we were looking for partners to community-based organizations to provide testing locations that we were always sent back to Chrysla. So it was a common thing, and I just want to highlight what they already had going on in South LA, and the support that they brought gave to CORE and what we have now. So it's home to me. Just
That's
wanted to
wonderful.
share that and put that on the record that I'm from the community, and I'm in this position just by having the just by connecting with Chrysla Elementary Church's community build, just by having that access, that opportunity. And I think many of us need to have someone in our community where we know we can go to and start out with just helping. I needed to get out of the house and stop. We were driving around with my family in our bubble.
And thank you very much, Mr. Watts. I think what you said is it's our home. And we want our home to be a safe place, as Cheryl Branch noted, I think at the very beginning. And you're continuing to establish that sense of safety and trust, and being able to go someplace where people will care for us. So thank you so much for sharing your story. And I also have the honor next of introducing our last speaker, our closing speaker for today. But first, just a quick recap. As you've heard from our speakers at the very beginning, Drs. Franco, Uskup, and Ms. Branch, there are things that we can do, that we know, that we've learned, that our communities need for us to act on in the future. And this is just a quick recap of the recommendations that they had. And you'll also be able to review those, as I mentioned, in the links that were shared earlier in the chat to the 3 reports. But now we have the honor of hearing from another great leader in our community, a colleague who has advised me over the years, Ms. Sonia Vasquez, who previously was part of the leadership team at a nonprofit that many of us know well, and is now leading us as the director for the Center for Health Equity at the LA County Department of Public Health. Sonia, if I could ask you to join us on mic, and we'll go ahead and advance your slides for you.
All right, thank you so much. I apologize to everybody. I know you had a lot of questions, and there's nothing I hate more than having to be put in front of you all, because it's important to hear from the community. And hopefully, I think there's going to be more of these opportunities to speak. So I look forward to being a part of those. And maybe at some point we can come together and have actual dialogue in person. The meeting after the meetings, I miss those, don't we all? All right, so I'm thankful to be here, to have the opportunity to be here. For those of you who know me, know that I spent most of my career really advocating for community-led partnerships and ensuring that government really reached out to community organizations and partners, stakeholders, residents, to make sure that they were part of the decision-making and connecting to the community at large. And I made the switch to the Department of Public Health just at the end of last year, because I felt like there was an opportunity here that the department really understood that need to connect with community, and not just for COVID, but for other inequities that our communities are facing. Next slide. Even prior to the pandemic, the department was really looking at how to advance health equity issues and create strategies that prioritize health equity. And so you'll see a number of our strategies really look at organizational competency. And when I say organizational competency, that's internal, right? The department's really looking at how do we do things internally, equitable contracting, data disaggregation, language justice. Those are the things that my program gets to work on, and hopefully at some point I'll get to talk to you. But it's also about amplifying community voices, building community capacity, forging partnerships and across many sectors and aligning current resources. Many of you may not know, or maybe you do, that the public health is a really small part of the overall county budget. And for the most part, a lot of our funds come through grants that we receive from federal and state entities. And so really looking at how do we use those resources to not just support the issues that we're funded to support, but also to leverage those to support other things, such as what we're doing now with monkeypox. Unfortunately, there has not been a lot of money or any money dedicated to really do what needs to be done in the community. So we've been able to advocate that we're able to use some of our CDC grants to support this work. Next slide. As many of you mentioned, there have been many challenges from the beginning, many challenges that continue to exist. And so in terms of the department's COVID-19 response, it really focused on protecting the most vulnerable, ensuring access to services and supports, and providing accurate, transparent, and culturally aligned information and programming. Next slide. But we couldn't do that alone, right? I think the department recognized very early that it needed to connect with trusted messengers, community-based organizations, faith-based organizations, schools, clinics, residents themselves, because really we all know that the not just Department of Public Health, but government in general has a trust issue with the community, right? Many individuals don't trust the messages they hear from government. So it's important that you have trusted messengers in the community working in alignment. And sometimes you don't maybe even realize that the department is part of that or is funding that organization. And it doesn't matter, because it really matters that the right information is going out from the right individual. Next slide. Many community investments were made to really ensure that we had organizations that could get the outreach and education, connect people to resources, have CHWs out in the community knocking on doors, that we had entities that could support essential workers to make sure they understood their rights and how to identify workplace violations and protect themselves, and partnerships with philanthropy to support those organizations that couldn't really contract with the county. As you all know, sometimes our county contracting is not easy, which is hence why we are working within our department as well as with other departments to figure out how we can streamline that system. So luckily we had many philanthropic partners who were able to step up and then we worked with Southern California grant makers to get mini grants out to FBOs and small CBOs who could actually help us with this work. Next slide. And so from the beginning and to this day, we really focus on priority communities and populations. These are areas and populations where we know that not only COVID has hit very hard, but that there has been a history of disinvestment, other factors and outcomes that have impacted these communities, other inequities that have impacted these communities, making it so that we knew that we needed to get targeted investments to these areas and to organizations that serve these populations so that we can make sure that they have been supported the most. Next slide. And one major strategy, go ahead and click again. One major strategy where we have really depended on a network of community stakeholders is really around the distribution of vaccine. You've heard it, people mentioned it today, how in the beginning there were a lot of challenges getting the vaccine out. The megapods were great, but they weren't great in our locally. A lot of us needed to have access to vaccines right in our community, right at our clinic, in our local park, at our local churches. And so we had to build up a network working with clinics like Kedron to really make sure that we were having people out there that could help demystify the concerns people had about vaccines, removing barriers around transportation, getting rid of appointments, and not having to have people have insurance was really important. Getting teams, we were able to also have teams that would walk around and do the vaccines, not just having people come to a site. Homebound, if you weren't able to come to a site, we had teams that were able to get to where to your home. And so because of that, we're at right now, as of yesterday, we're at 81% who have of our community of our overall county that has received 1 or more doses. However, next slide. As you all know, inequities still exist. Unfortunately, you'll see that specifically with the African American community and of course the Latinx community right above it, that we are not doing well, right? We have for the Black African American community, vaccine uptake is at 60.2%. The Latinx community, it's at 63.8% compared to our white community, which is at 78.2, and Asian community, which is at 87.3. Although I should note that even within the Asian community, that's a big swath of communities within itself. And so there are disparities within that as well. And then of course, it's, hasn't been out for a while. So there's a number of reasons why people are nervous about having their kids vaccinated, but our numbers are low. For 5 to 11, we're only at 40, just almost at 41%. And for children under 4, it's at 8.3%. And if you break those numbers down even by ethnicity, they get even lower. And we have communities that continue to be low in vaccinations. Antelope Valley, we have some communities that are as low as 38%. We have parts of South LA that continue to be at 68, 74%, as well as the same in Southeast Los Angeles. So there's still much more that needs to be done. Next slide. And so we're hearing the same thing you all are hearing. People are just tired. People want the pandemic to be over. And I get it. We all get it. But we all know the pandemic is not done with us. We still have it. We will have it unfortunately, we will have COVID-19 for a while. We know that people didn't go to their health visits for a number of reasons, but we're already dealing with communities that have high levels of chronic disease. And so that's just going to get worse. And unfortunately, we're probably going to see mortality. We're going to see deaths in our community because of preventable chronic disease issues. We have healthcare access issues. We already had a shortage of healthcare workers. That just got worse. We lost healthcare workers who were succumbed to the disease. We had people that just had to stop because it was so devastating. It was so hard. They had to just step away from this work. And so now we are going to have a huge impact. That's a huge area that we are going to, we were already challenged with. We're going to be challenged even more. We all know about the technology gaps. We talked about that. We have a digital divide, and we have people that are just never going to recover from this new world. We have a lot of people excited about this issue of remote work. Well, that doesn't work for everybody, right? So how do we move beyond that? And we just haven't achieved financial recovery. People have lost jobs, access to supports. People have died. There have still sicknesses and illness, long COVID, that is impacting their ability to take care of themselves and their family. Next slide. But we continue to work and to move on. We continue to invest in partnerships. I'm excited every day I hear our director, Dr. Ferrer, say that, when we get grants, we need to really think about how we get that money out the door, right? We're trying, while some grants are coming to an end, how do we get other grants that can continue? How do we get other funding to continue to be able to invest in our partnerships? Because we know we need you all. And so how do we do this in a way that can fund as many of you as possible? We need to continue to invest in policies that offer worker protections, foster family stability, and support overall well-being. There are a lot of things that we oversee. There's a lot of things that we have to partner and advocate to our board, advocate at the state to make sure that our neighbors are protected. Keeping an eye on the pandemic. Again, this isn't over. We continue this pandemic, the next pandemic. We have to stay vigilant. We have to make sure that people get the next booster, and potentially the next booster after that. You know, we want to make sure that people are taking care of themselves. And again, not just because of COVID or monkeypox, but just in general, that people are using safe precautions when they're in large settings. And strengthening our public health infrastructure, we continue to advocate that funding comes into the county to support public health. We feel like people get it now that, you know, there's a need for public health resources, but, you know, who knows? I don't know if that sentiment will continue moving forward. So we need to keep that on the forefront. And when we say public health infrastructure, we're just not talking about within the walls of DPH. But that includes all of you, because we all need to be a part of this process. And if I can end on this one slide, I think I did this under 10 minutes, is that partnerships are critical. We need all of you. You all know this. I know we've, you know, outside of this job, we've talked about this. We need all of us for our communities to be healthy. And you know, that doesn't mean that public health can say, oh, it's, you know, well, we have to do it with you, so we can't, you know, or else we can't do it. No, we have a role to play. We have to make sure that we still continue to beat that drum and make sure that there's funding, make sure that there are services, make sure that our services are offered in a way that doesn't add confusion or create further barriers, right? There's still work that we have to do internally, but we can't do it without you. And I'm excited to be on this side of the wall to work with you to bring you all in. Thank you so much.
Thank you so much, Sonia. And I appreciate your thoughtfulness and the Department of Public Health's leadership as we moved into a crisis, a health crisis, an economic crisis, a social crisis that many of us did not know how to respond to. Really appreciate your comments about being proactive and thinking about what we can do together in partnership, especially in starting with the South LA and Southeast LA community networks that were listed here, and also being proactive in terms of addressing what might be on the horizon. So we have a couple of minutes, and I know there were a few folks who still wanted to make public comment. If you're still with us today and you're able to join us on microphone, would like to see if there are any community members and leaders who joined us who are part of these networks, and if you'd like to share any public comments. And if not, I'm totally fine with calling on people who I still see on our participants list today. So I would like to see if there's anyone who'd like to make a public comment, but if not, if Dr. Tracy Veal is still with us on this call, Dr. Veal, I know we had a chance to work with you and the department for a brief period on one of the work groups. Dr. Veal.
Oh, hi, thank you all. And thank you for both South LA and SELA coming forward. So I really appreciate all of the work that was done on the ground in the trenches. I remember working 24 hours a day, 7 days a week with some of you physically on the ground. So I really appreciate all the efforts, particularly with the faith-based communities. There was over 400 churches that are now part of all of these efforts in the community. So thank you so much for that. And I was honored to be a liaison for equity during that time for the COVID vaccine. Thanks a lot, Rosemary.
Thank you. Thank you, Dr. Veal. And I hope we get to work together again, hopefully not on a crisis or a disaster on the scale of COVID-19.
Yes.
But I want to thank our planning committee again, the Community Response System of South LA, the SELA Collaborative, the COVID-19 Vaccine Equity and Access Initiative, and everyone who took the time to help someone find a testing site, get a bag of food, reach out and get some healthcare when they needed it, find a place to stay, or even just offered some comfort in words and a hug. We all carried one another through this time, and we'll all need one another as the next crisis might emerge. And I thank you all for joining us today for this convening. And please stay connected to one another. We need one another to take care of our community. So thank you everyone for all of your time. And we'll be stopping the recording. Thank you very much.